Hello, and thank you for joining us today. My name is Marilyn Cook, Marketing Manager for Professional Insurance Programs, and with me today is our Benefits Division Team Lead, Christine Nadolski. Today we are going to discuss a topic that our benefits team gets many questions about, Medicare. Professional Insurance Programs, a division of WDA Insurance and Services Corp., has teamed up with Alisa Allen from WPS Health Insurance to bring you this educational session where we will review what you need to know to navigate the federal Medicare program and what you need before, or when you can enroll in Medicare.
Excellent, Marilyn. Oh, go ahead,
Before I hand this off to you, Alisa, I would like to go over a few things. Throughout this presentation, feel free to submit questions in the control area of the control panel. We will take time to answer all of these questions as the presentation goes on. Also, on the right-hand side, there are two attachments for you. And on that note, I am going to hand this off to Alisa, and thank you so much for joining us.
Thanks so much. Is the sound good?
The sound is good.
Okay, great. So thank you all for your patience. We had a little technology excitement here on Friday morning. So my name is Alisa.
We just can't see your screen yet. You just need to accept.
Oh, I need to accept. Okay. And
there we go.
Okay, and we're on. Let me just flip it. Did it flip?
Yes.
Okay, great. So thank you, Marilyn. My name's Alisa Allen. I'm with WPS Health Insurance. We have a long partnership with professional insurance programs and the WDA program. I'm here, as Marilyn said, to just go over the basics of Medicare. So, and when you enroll in Medicare. If you need to ask any questions, we'll keep this pretty fluid. I'm going to sort of, because of being mindful of your time this morning, I'm going to sort of move quickly through this information. I would like you, though, to pull up that 2022 Medicare costs. That's one of the handouts. I will be referring to that during the presentation, so I'll let you know when to take a look at that. The other handout that Marilyn noted, the Cruising into Medicare, that's for your information. Please look at that later on. I think of that as the cliff notes of what you need to know about Medicare. So it's all condensed into a short little brochure that we put together at WPS. So to get this kicked off, I get it from WPS. The reason why I'm really here is because we are a big claims processor for Medicare. So we know our Medicare stuff, and that's about all you're going to get for the company promo for this session. So I'm going to take a look at the basics of Medicare first and give you a feel for what is Medicare. There's 4 parts of Medicare. Medicare Part A is the hospital component of Medicare, and Medicare Part B is the professional component of Medicare. That's what we would call original Medicare. This is what my grandparents had back in the day when I was helping them in the 80s. This has been around since 1966. It's an entitlement program for folks that are over age 65 and also people with disabilities that qualify for Medicare disability. This has been around a long time. We're going to focus on that part of it. We're also going to take a look at some of the newer programs in the Medicare world. Medicare Part C, which is Medicare Advantage. We're going to talk about how that is a newer comer to the world of Medicare, and it basically is designed to replace original Medicare. I think of it as private Medicare administered by insurance companies that have been contracted with the Centers for Medicare and Medicaid Services, CMS, to administer and process Medicare services for participants. And then finally, and what we'll actually take a look at first, is Medicare Part D drug plans. Now, all of these programs are overseen by CMS. I'm going to use the acronym, but Medicare Part C and Part D are going to be special because those are the plans or the programs that are now really in play starting October 1st during this Medicare open enrollment period. So I'm going to touch on those, on that open enrollment period, what it's about. You see a lot of stuff on TV, a lot of things, a lot of mailings, things happening. Hey, it's your time to switch. So when I get to these two programs, when I sort of drill down on these, I'm going to remind you that you're able to switch Medicare Advantage plans from year to year, and you're able to switch Medicare drug plans from year to year. Think of Part A and Part B as sort of the base that you start with, and then we start bouncing off of that with different types of approaches to Medicare. So I will get to that in a minute because I'm going to first take a look at Medicare Part D. This is the drug component of Medicare. Private insurance companies are contracted each year to provide or to offer Medicare Part D drug benefits to beneficiaries. And in our world, it's the state of Wisconsin is the region, if you want to say, for these 27 Part D plans that will be available next year. They change from year to year. There could be deductibles, drug co-pays. There's different levels of benefits with drug plans. I could spend a whole hour, which you don't want right now, a whole hour talking about Medicare Part D plans. But sort of in a nutshell, it makes sense to take a look at them once you're in Part D world. Take a look at them every year. And I'm going to refer to, in a minute, I'm going to refer to how much these cost in general, the cost of drug plans, but they can go from $12 to over $100, depending on the plan, depending on the formulary that those plans offer and those plan benefits. So each year there's a basic criteria that each drug plan has to follow, and then they can pivot off and customize plans to me for that company to offer to their clients. And again, you can change these drug plans every year. You need to, and we're going to talk about, you need to figure out something. Once you're in the Medicare world, you need to figure out a drug solution. That's what I'm going to call it. Some way you're going to handle your drug coverage, because you're going to find with Medicare, once you're ready to enroll, and that's going to be the last part of our presentation, I'll go through when you should enroll or the times that you can enroll in Medicare Part A and B, and then pivot into these other coverages. If you don't do it when you should, you could be penalized, and that's a part of Part D, and also Part B, the physician component of Medicare. So I'm going to go over that in a minute. But for people with drug plans, again, you can switch them every year once you're in this world. The benefits change every year, the formularies change every year, what's offered changes every year. But the state of Wisconsin is pretty awesome because we have a state pharmaceutical program, and you're thinking, well, what does this have to do with me? Because the purpose of that program was initially to provide coverage for people who have lower incomes, more of in the poverty level of income, and help subsidize their drug costs. But with the state of Wisconsin's coverage, it also can be a placeholder for people who may not need a full blown drug plan. Costs $30 a year. Your friends at PIP, I'm going to call our professional insurance program staff the PIP people. Those agents can help you talk through what senior care is. But for $30 a year, it's an awesome placeholder that Medicare says is a comparable or credible coverage for a drug plan, and you can avoid penalties if you don't need drug coverage when you're ready. So that's great. You can pivot off once a year into a drug plan, disenroll from senior care, our Wisconsin state plan, which is really nice. Especially, we're going to find out people who make more money pay more for Medicare. So I'm going to get into that in the next slide. And again, Marilyn and you guys, I'll be sure to give you a copy of this presentation so you can send this out to the attendees. But I'm going to run through really quickly. I was alluding to a few things here about costs. I'm going to run through sort of like giving you an idea what Medicare is going to cost. So Part A, for most people, it's not going to cost anything. I'm not going to call it free because you have paid payroll, or your spouse have paid payroll deductions, those Medicare payroll deductions, and you've prepaid for your Part A over the years. If you put in 40 quarters, i.e. 10 years, you have paid for your Medicare Part A. For those who haven't put in that full time, they could pay up to $499 a month for 2022 for coverage. Now you're going to see on this chart, it's like, whoa, Alisa, what's this penalty stuff now? Now the penalty is in place. Penalties come into play if you don't take coverage when you're supposed to. So for Part A, again, most people get it for free or at no cost because you've already contributed to that cost. The late enrollment penalty is only for people who have to pay that don't take it. More of the rub is going to be in Part B, the physician component of Medicare. Standard price in 2022 is $170.10 per month. Now with Medicare world, you're all in a single world now. So my husband and I, when we're going to be in Medicare, we're going to be single policies. There's no more family plans, no husband and wife spousal coverage. It's all singles. So the thing you're going to see is Medicare wants you to enroll when it's your time. That might not necessarily be when you're 65, but when it's time for you to enroll, they want you to enroll timely. If you don't, you are going to see a lifelong penalty, 10% for each 12-month period. You could have had Part B and you didn't do it, and you didn't have employer coverage. So the other thing I want to point out with Part B, you're going to see higher income earners pay more or may pay more. So that handout, that 2022 Medicare costs on the second page shows you the chart for 2022 called an IRMA adjustment. This is the adjustment that people who make more money pay for the coverage. So I always want you to keep that on your radar, that it's just not that standard 170.10 per person per month for your Medicare Part B coverage. If you're a higher earner, you're going to pay a higher premium. Once you retire, once you restructure your earnings, you can, because Medicare goes back 2 years, they're, surprise, surprise, connected with the IRS. So they all talk to each other. But if a lot of people have strategies once they're ready to retire, they start shifting income, they have different things going on. You can ask Medicare to reevaluate your income once you've retired and you've shifted assets, done stuff that you have a lower reportable income. They can change this contribution. We had to do it for my mom when she got further into retirement and her assets changed. So that can be done, but again, they'll go back 2 years. That's for B. So remember, you need to take B when you need to, and if you don't, there's a penalty. Medicare Part C, those Medicare Advantage plans, which we'll talk about, those prices vary by plan. Also, Medicare Part D, prices vary by plan. And here you go again on page 3 of that handout I shared with you. For drug plans, higher income earners will pay more if they have over the income limit set by the IRS and set by Medicare. So that's just to keep, again, those costs, because that's going to be added above your Part D premium. And now that's why that senior care makes sense for people who have few drugs, no drugs. Why apply for something you don't need when you can have that placeholder for $30 a year versus paying a premium cost if you're a higher income person above and beyond Medicare? So the folks at PIP are going to be able to talk you through that, but that's why we're very lucky in Wisconsin that we do have our state pharmaceutical plan to help, especially people who don't necessarily need the drug coverage. Because remember, Medicare wants you to take it if you're eligible, otherwise they penalize you. And again, this is a lifelong penalty. So that's why that state program's pretty neat. If I have like a generic drug and it's just, 10, 15 bucks a month, I'll self-insure myself. But the nice thing again about that state pharmaceutical plan is if, oh my gosh, I just got diagnosed with stuff, I'm going to need to start taking meds, I can roll off that plan once a year and have a drug plan effective the first of the month of the next month that after I apply. So I've got a safety net that I can bail out of the state plan once a year. So again, you can ask your people over at PIP for more information on that. So now I'm going to go ahead and sort of circle back to the first page of this handout and talk about the building blocks of Medicare. I'm going to start with Medicare Part A. So again, Medicare has been around, Part A and Part B, they've been around since 1966. There is no network with Medicare. What it is you can go to any provider, you can go to any hospital, any doctor that accepts Medicare patients. All hospitals are required to take Medicare patients. They may ship you out if it's not quite the appropriate point of care. They might put you into a different hospital after they triage you, but pretty much all hospitals take Medicare, and then a lot of physicians within the U.S. accept Medicare patients. So with the hospital component of Medicare, again, this is facility billed services, there's going to be a deductible. So you're seeing now benefit period deductible. This is different from calendar year deductible, which I'm used to. So I want to take a minute to talk about what this means. So Medicare is all about day counting. It's not about the diagnosis. It's not a per illness deductible. They're really looking at days in patient or in a facility. So when you first get admitted to the hospital, could be July 15th, boom, that's going to start your benefit period. And when you start a benefit period, there's a deductible. For 2022, it's $1,556. My whole presentation is still going to reflect 2022 amounts. Some amounts have gone up, some amounts have gone down for 2023. Those are all coming out right now. But when I'm first admitted, I have a deductible that I'm responsible for. So then after that benefit period starts, and if you look at the first page of my handout of 2022 Medicare costs, the Medicare after that deductible is going to pay the first 60 days at 100%. So Medicare starts counting the days after you're admitted, after deductible. And again, I'm going to throw out here supplements, pick up these deductibles, pick up these copays. So don't be alarmed by that. There's products that work with original Medicare that clean up after Medicare does their stuff. But if you look at your handout, after 60 days, because remember, Medicare's counting days, and the older we get, the longer we could be inpatient. So a lot of times it's like, oh, I wouldn't be inpatient 70 days. Sure, if you had a stroke and a heart attack right at the same time. My friend's mom was in for 85 days inpatient. So she, in her situation, she had a deductible, and then she had the first 60 days at 100%. And then you're like, wow, $389 per day from 61 to 90 days. That's the per day copay. And then you see when it gets into the 90 plus those reserve days, then it turns into $778 per day. Supplements are designed to pick that up. So don't worry about that. We'll get to supplements in a bit. But a lot of times we're just not in straight through for 90 days or 70 days. We may be in for 10 days and then we're discharged. Now, if you are not, or if you are readmitted within 60 days after you're last released or discharged, that's going to be in the same benefit period. So what I'm saying is I'm in 10 days, Medicare's counted 10, then I'm discharged, let's say for a couple weeks, and I'm not doing really well. And I'm readmitted. Because it's less than 60 days from when I was last let out, Medicare's going to start counting on day 11, 12, 13. So they're going to keep counting away on this protocol of 60 days, 90 days, 150 days. So they're going to keep counting. So let's say I'm in for another 10 days. So I have 20 days into my benefit period. I'm still at 100% after my deductible. But let's say I'm discharged and I do great for like 8 months. 8 months. I'm doing great. And then I fall and I have to be sent to the hospital, admitted to the hospital because it was 60 days past the last time I was discharged from my last benefit period. They're going to start another benefit period and it sort of starts counting all over again. So I have another deductible. Again, supplements pick that up. So I don't want to be alarmist on that. That's why you take a Medicare supplement with original Medicare. It cleans up those deductibles, cleans up those daily copays. So Medicare is going to pay hospital charges under A, skilled nursing facility. This isn't custodial. This isn't memory care like my mom's in right now. This is I'm not ready to go home. This is when my dad fell, broke his shoulder, cracked a vertebrae in his neck. He was in the hospital for a number of days, and then he went into a rehab facility, a skilled nursing facility, and he was in there for another 2 months. So you're going to see on that handout, okay, now at the first 20 days in a rehab facility, paid in full by Medicare, but then, whoa, there's a $194.50 per day copay from days 21 to 100. Those are picked up, those copays are picked up by a supplement. And then Medicare will pay up to 100 days per benefit period in a skilled nursing facility. Remember, this is just to get you back on your feet and get you home. It's not meant to be a long custodial type care scenario. Medicare doesn't pay for that. So in Part A, skilled nursing facility, hospital charges, and hospice care, end-of-life care are all covered under Part A. Part B is a little different animal here. So Part B is the second part of original Medicare, and this is the physician component of Medicare. Medicare will pay for office visits, labs, x-rays, chiropractic care. All those professional type of services are billed through Medicare Part B. To mess you up, there's a calendar year deductible. So you don't have to worry about that benefit period deductible with the Part A. Now you're in a calendar year. This year's 233. I want to say it went down a little bit for 2023. Shock, it did. But what Medicare does is they pay 80% of what they approve. So if a physician bills $300, Medicare approves 100, Medicare's going to pay that at 80%, leaving 20% as your share or the patient's share. That's picked up by supplements, and again, we'll get there. Most providers take what we call Medicare assignment or are participating Medicare providers. So when you're looking again, like I mentioned with Part A, Part B, you can go to any Medicare provider in the US. You don't need referrals. You don't have that sort of level of managed care with original Medicare and Part B especially. If I want to go to Mayo Clinic, I sure can. The the trick though is, again, most providers are good with what's approved, and then they'll go from there. They're going to write off that $200. Remember, Medicare that was billed $300, they approved $100. A provider that accepts assignment, or also called a participating Medicare provider, they're going to write that $200 off. But there are some providers out there that are like, yeah, we like Medicare, we like Medicare patients, but we want to bill a little bit more. Those are providers that don't accept Medicare assignment. They're also called non-participating Medicare providers, which is very confusing. But all that means is those providers will accept Medicare patients, but they will charge up to 15% above what Medicare approves. So a good example of that is I'm here in Wisconsin and I want to go to Mayo. I can pick up the phone, I can make an appointment with Mayo. I don't need a referral, but because I'm not a Minnesota resident, they're going to take me, but they're going to charge on 15% above what is approved by Medicare. So in my simple situation, 300 billed, 100 approved, they're going to take 15% of that $100, tack on another 15, and then they still have to write off that $185. So I always joke, Mayo, add a 0 or 2 onto those 300 and 100, but that gives you an idea. Again, a lot of providers accept assignment, are participating, but others may not. Supplements are designed to pick those excess charges up, and we'll get into that. So that's sort of the scoop. If you've got a provider that just doesn't play with Medicare, they're not contracted with Medicare, there's no Medicare benefits for those providers. To get Medicare benefits, you have to be contracted with Medicare. All right. So again, Medicare Part A and Part B are together are original Medicare. And Medicare doesn't pay for everything. They don't pay for long-term care, like my mom's memory care isn't paid. If she has a doctor's appointment, if she has to go to the clinic or hospital or needs labs, x-rays, those are all covered under Part B. If she goes to the hospital, it's going to be covered under Part A, but her core memory care per monthly charge is not covered by Medicare. Doesn't cover dental services. Could be a few. You guys are the experts, not me, but there could be a few things covered by Medicare, but we pretty much tell people you have to buy a separate dental program. Hearing aids and exams are typically not covered by Medicare. Routine eye exams, glasses, routine foot care, etc. These things aren't covered by Medicare. So I'm going to pause now, and now we're going to regroup, because I alluded in the beginning of this is that the first thing we do is we set the stage, and setting the stage to then move to the rest of what we need to do is we need to be ready with Part A and Part B with any way you go. If you want to stay with original you're always going to have to sign up for Part A and Part B, and then things can happen. So if I'm going to go the original Medicare route on the left, I'm going to figure out my drug solution too. Do I need a drug plan? Which drug plan makes the best sense to me? And what I didn't tell you is, just because a drug plan is good for you, it might not be good for your spouse. Your neighbor's plan, as much as they love it, might not be the best plan for you. So when it especially comes to drug plans, it's really based on your list of drugs and what the companies provide. So a lot of times we could see spouses on different companies because their formulary doesn't quite match up with both of them. So again, it's a very individual choice based on your own needs. But if you're going original Medicare, figuring out what do I need to do for my drug coverage, and then I want to add a supplement, which we're going to get into in a minute. But I'm going to sort of pivot right now, and I'm going to look at the Medicare Advantage world. So before I even get into Medicare Advantage, I need to be sure I'm signed up for Part A and Part B, because guess what? Even with Medicare Advantage, you don't escape paying for Part B. Everybody pays for it except very, very low income folks on Medicaid. But most people still have to pay for Part A and Part B, or Part A if they have to pay for it, or Part B, that premium still has to be paid. A lot of Medicare Advantage plans may cover a drug component, and there's some different things. There could be there's out-of-pocket costs for sure. There could be some extra benefits. So I'm going to take a look for a couple minutes at Medicare Advantage. So like I mentioned earlier, Medicare Advantage plans are, if you want to say the bundle of benefits under A and the bundle of benefits under B, the physician component, all rolled together, and now it's offered by a private insurance carrier that's contracted with the government, and it's subject to their medical management. So there's going to be referrals, and again, those basic benefits are going to be in there, and maybe drug coverage, but there's going to be some other caveats now, because what happens is you're still paying your Part B premium. Those Medicare Advantage carriers are compensated by the federal government quite a bit through what the Part B premium. So they get X amount of dollars per belly button in their plan from the government, and they administer their plan benefits and administration costs through that contribution, or that money from the government. With Medicare Advantage plans, you're going to see networks. And there's going to be managed care. Nothing wrong with that, but you're going to need a referral. You may not be able to go to Mayo if you want to. So when I look at Medicare Advantage plans, something that's very attractive to people is a lot of times it's a very low premium, or maybe a zero premium. But if you're me, Elisa's going to tell you nothing's free. So you either pay a premium with a Medicare supplement, or you may pay nothing, air quotes around nothing, and you pay when you have services. So there's going to be out of pocket limits. There's going to be co-pays, deductibles. The other thing is interesting with Medicare Advantage plans, as I alluded with drug plans, they change every year. So something you may have bought 3-4 years ago with a Medicare Advantage, it's definitely changed by 4 years. They change every year. They change providers. You are sort of in their world. Sometimes you see some networks on Medicare Advantage plans that have out of network coverage. That can constrict and change over time because they have that ability every year to change. You're also able to change from a Medicare Advantage to a Medicare Advantage every year. But just remember, now you're in the world of, I've got paperwork, I've got to have somebody help me. If I start losing my ability to manage my own affairs, that type of thing, you have paperwork. The lock-in period alludes to right now is the Medicare open enrollment period, which is a little confusing. This is the time starting tomorrow on October 15th that you can start electing for a new drug plan or a new Medicare Advantage plan for a January 1st start. So this is why you're going to see a ton of stuff on the TV until December 7th. You're going to see a lot of advertising. It's your time to change. It's your time to choose. So you can have this period of time, if you're in this world, to reevaluate, do I want to change my plans? And then you're locked in for the next year. All right, so that in a nutshell, and the cruising into Medicare piece that I gave you, don't open it up now because I got a bit more to go. But in the middle of that handout, there's a comparison between Medicare Advantage and Medicare subs. And again, your friends at PIP can go ahead and talk you through that. There isn't a right way or a wrong way with either way you go, because now I'm going to go through more the traditional picking a supplement and having Medicare Part A and B. It's really suitability. So I'm going to take and pause now and look at Medicare supplements in conjunction with my original Medicare. So again, I have to sign up for A and B, and then I have to figure out what I'm going to do with my drug coverage. And now I'm going to look at a Medicare supplement, which is designed to pick up after Medicare. So when somebody tells you, hey, all these Medicare supplements are the same, just pick the cheapest one or whatever, yeah, they are the same with basic benefits. They all pick up those co-pays for inpatient. Once we got past 61 days, they all pick up the 20% of what Medicare approves. They pick up some bloods, some inpatient psychiatric and hospice care. But in Wisconsin, we're a little funky because we can build our supplements. So the blue is that base coverage that I just had that last slide. The co-pays, the 20%, that's all part of the base benefit. Then in Wisconsin, your friends at PIP can help you build a supplement. So you can pay, and all these orange or gold boxes are riders, insurance riders. So they're little mini policies that are attached to the basic benefits. And there is a rider to pick up the Part A deductible. So my dad was in multiple times in the hospital. He had 100% Part A deductible rider, picked it up. Those of you who were 65 prior to January 1st, 2020, or were eligible for Medicare due to disability prior to 2020, you can still buy a mini rider to pick up that deductible for Part B. That's $233 a year. Otherwise, the government wanted all of us to pay for it out of our own pockets. So that rider's not available for people who are newly eligible. But there's that rider, that Part B excess charges rider. That's going to help me when I go to Mayo and I live here in Wisconsin. If I want to save a little bit of money, I've got that copay rider, co-insurance rider. It throws on an emergency room and an office call or office visit copay. That can save some premium. You can pick up some additional home health care, and supplements have an optional foreign travel rider. So one thing I want to take a note of or have you remember, Medicare does not pay out of the US. It doesn't pay in Canada on your fishing trip. It doesn't pay on the Caribbean cruise. Yes, if you're going to Puerto Rico, yes. If you're going to St. Thomas, a US territory, yes, there's Medicare. But if you're going to Germany on a river cruise, nope. So this is a very low cost addition. Um, I'm a big traveler. I'm assuming some of you folks might be travelers. If you're going on big trips, please look at travel insurance, because with these foreign travel riders, with these and they're good. They're depending on the company, they're a neat little benefit. They reimburse you for those out of country claims. But if you're in Germany and you have a major incident and you want to come home, medical evacuation typically is not covered under these type of riders. So it will take you to a beautiful hospital giving you appropriate care in Germany, but it will not pay for you to come home. I always told my dad, it's not like you're going on economy or in coach with an IV. You're on a private jet, you have medical staff, it's expensive. And that's why a lot of those medical evacuation travel policies are a little pricey, but well worth it if you have a major incident and you want to be home with your family with you. So that's the nutshell. Again, you build a supplement in Wisconsin, and your folks at PIP can help you with that. All right. So with supplements, they're a little different from Medicare Advantage plans. So a couple things is they are what we call guaranteed renewable. So what you buy next January 1st locks in. It's not going to ever change the benefits. The premiums can change. The benefits don't change. So you can't be canceled. You can be canceled if you don't pay, but you can't be canceled because my dad was the worst risk probably for out of a lot of people. He had a ton of stuff going on. They could never bill him differently, surcharge him for his medical stuff. It doesn't work that way. So once you buy, you know what you got. It's not going to change. There's no network. You can go to any Medicare provider, so you're the boss. If you want to, my dad had a WPS policy with us. He had a house in North Carolina and a house in Florida. He had a team of providers in each state. He didn't have to ask for permission. He didn't have to get referrals. He just made appointments with providers that accepted Medicare patients and was good to go. Prices for plans vary. I don't talk about pricing in this presentation. You can talk to your friends at professional insurance programs, but prices will vary. I always say if it sounds too good to be true, that's a red flag. You want to go with a company that's got long-term stability. They have a good track record on their renewals, because the thing with Medicare supplements that are different from Part D plans and Medicare Advantage plans is you do not have an annual open enrollment for supplements. It's only for drug plans and Medicare Advantage plans. So with a Medicare supplement, if you go original Medicare, try to make the best choice possible, because if you ever want to change your supplements down the road, you typically have to show medical underwriting or be approved. So some companies have people like a interview, they have long questionnaires. Some companies like ours short medical questions, but we're looking for serious stuff. And if you've got cancer, a lot of people want to move out of Medicare Advantage when they have stuff going on. It's like, wow, what do you mean I can't go to Mayo? I want to get out of Medicare. Medicare is weird because they'll let you get out of Medicare Advantage, and you're like, so what's the problem? The problem is you do not want to be on original Medicare without a supplement. I already went through the hospital out of pockets. It can be devastating if you don't have a supplement to pick up after original Medicare. So again, the government makes it very easy for you to pivot once a year out of a Medicare Advantage world, but you have to be sure you can qualify for a supplement, because these are not involved in that annual Medicare. It's your choice. It's only drug plans and Medicare Advantage. And I know I sound like a broken record, but this is what people get messed up on. So just wanted to share that. All right. So I'm going to really briefly go through some of the caveats with enrolling in Medicare. So most people are not automatically enrolled in Medicare. They are enrolled automatically if they are already on Social Security. So they elected to receive Social Security monetary benefits early. Medicare will sign you up automatically 3 months prior to your 65th birthday. If you are on true Medicare disability, you will be automatically signed up after the 24-month qualifying time to get on Medicare disability, or if you have Lou Gehrig's disease. These are the only times you are automatically signed up. You will need to trigger that first step. You're going to have to trigger the A and B. So you must sign up if you aren't receiving Social Security. Now, it doesn't necessarily, and we're going to get into this, it doesn't necessarily mean I'm turning 65, I need to sign up. That's not what we're saying. But if you want to receive Social Security at age 65, you need to sign up. If you have end-stage renal disease, or if you're not eligible for Part A free, a premium-free Part A, and want to buy it, you have to sign up. But the big thing here is most people need to sign up. A lot of people delay Social Security. So separate that monetary Social Security out from Medicare medical benefits. These are two different things. They're interconnected, but they're two different things. So I'm going to take a look now at the 3 times you can sign up for Medicare Part A and B. There's the initial enrollment period, there's the special enrollment period, and there's a general enrollment period. So I'm going to first take a look at the initial enrollment period. This is when you're 64. My husband's turning 64 next month, and he's like, why am I getting all this stuff in the mail? I'm like, well, just enjoy it for the next year. You're going to be everybody's best friend, and people are agencies, insurance companies, we're guilty too at WPS. We're all going to be sending packets. That's why I love the agents. That's all I do is I work with our independent agents. Work with your agent to help navigate this, because everybody's bombarding you. But when you first are eligible to sign up, so this is the first time you can sign up for Medicare is when you're turning age 65, the 3 months prior, the month you turn age 65, and the 3 months after. The 7th month period is your initial enrollment period. And I'm going to use my husband as an example because he will be turning 65, and he's on my group plan. He's been retired for 7 years now. He's on my employer plan. And when he turns 65, we're going to take a look. He doesn't necessarily need to sign up because I work for a large employer. I work for a group over 20 in size. That's considered a large employer group, and we'll get into that. But we're going to take a look at his initial enrollment period. Does it make sense for Tim to peel off my employer plan and sign up? Or if we were all retired up, we would definitely be signing up for Tim when he turns 65 a year from now. And I recommend, please be the early bird on this. Sign up before you turn 65. Medicare has been extremely slow with getting Medicare cards, your new Medicare number. It's not your Social Security number anymore. It's a unique Medicare number. You want to be sure you have that. You need that to sign up for a supplement. You need that number to sign up for Medicare Advantage. You need that number to sign up for a drug plan. So start early, because even though they give you 7 months, once you get past the month you turn age 65, when you pull the trigger and apply, you get into that 3 months after, you're like, well, what's the problem? They start delaying the effective date out 2 months, 3 months, depending on what month after you turn age 65, if you're going to jump in during this initial enrollment period. So be early, start 3 months prior out. That's my recommendation. Now, not everybody has to sign up when they're 65. If my husband, I'm going to use him as an example, if he stays on my group plan, because he'll be 65, I'm still going to be working. I can keep him on my group plan. It's over 20. And also, if you're part of a multi-employer group, WDA has a program. One of the groups I'm sure are over 20 in size, you're considered what we call a large group as part of that multi-employer plan. But if your practice or your business is over 20 employees and you have insurance, group insurance, that's going to be primary. Or first up before Medicare. So in that situation, if Tim stayed with me until I retire, he'll be 67 when my retirement plans are going to kick in. And so I can keep him on. He doesn't have to take any Medicare at all, nothing. Because we have to look at IRMA. We have to look at how much does it cost for him to be on Medicare versus staying on the group plan. So when I retire, he can still stay along with me, but as soon as my coverage due to current employment ceases, boom, that's going to trigger a special enrollment period for Tim. He's going to have 8 months. He wants to do it sooner, trust me, but he's going to have 8 months to sign up for A and B, no penalty. This doesn't apply to people with end-stage renal disease. That's the ESRD. But again, for most people, if they've delayed Medicare enrollment because they're on their plan, their employer plan or spouse's plan, you're all good. You can sign up, no penalty. And people do this all the time. And the reason I'm stressing this is I've done a couple of these presentations and I've had people go, man, my friends all told me I had to sign up for Part B and they were paying for Part B and they were under a group plan that was primary. I'm like, you're paying for coverage you don't need. Don't pay for that B until you need to. Don't apply for it until you need to. And finally, there's a general enrollment period. This is truly the cleaner upper for somebody who just didn't apply for Medicare. They're like, I don't want Medicare. I don't have a group plan. I just don't need it. I don't want it. For whatever reason, it happens. This is going to be from January 1st to March 31st. Right now, currently coverage would begin in July 1st, but starting January 1st, they're changing this to have that coverage kick in much sooner than July 1st. There isn't such a big delay. But if you're signing up as a cleaner upper here and getting into A and B, and especially B late in the game, way past when you were supposed to, you're going to have that penalty that we talked about earlier in the presentation. So that's why I always recommend everybody, even if you're still working, touch base with Medicare, touch base with Social Security, let them know what you're doing. Because at the end of the day, if an insurance company lady makes a mistake, one of your agents, which they're wonderful, doubtful they would make a mistake. Maybe it's somebody at your clinic who handles the HR told you something wrong. I hate to tell you, Medicare isn't going to really probably care unless they make the mistake. So you guys are all in the medical world with being dentists and providers. I would definitely, if you're contacting Social Security or Medicare, document the date, time, who you talk to, because if they make people are new all over the place. So, you could have somebody new who maybe gives you some misinformation or makes a mistake. They're more likely to fix their errors than somebody else's. So that's why we always say just do your housekeeping. Even if you continue to work, you're going to be covered under your group plan. Just be sure you touch base with Medicare / Social Security when you're turning 65, and maybe they're and going online, and maybe they just say just don't do anything. So again, it's always good to just take that extra step and be sure you know what your situation is, because depending on your group plan, if it's small group, large group, we're going to get into this in a minute, you need to find out how it works with Medicare. And some coverage, especially small group under 20, if you're not part of a multi-employer group that has one of those groups over 20, you're going to be subject to Medicare being first. So you're going to need to take Medicare if you work for a freestanding small group or have a small practice under 20, you will need to take Part A and B, because that's going to be typically first up prior to your group insurance plan. So also the other caveat with larger group 20 plus, you have the situation of COBRA, where in my situation, when I retire, I won't be 65 yet. I'm sort of playing out to give myself a buffer with COBRA. Tim could stay on with me and ride through my COBRA with me. But the problem is once my active employment changes and I'm not covered due to active employment under my insurance, it changes who pays first for my Medicare eligible spouse or me Medicare eligible. So that's why they're saying, even though you may have Cobra, and it's like, well, hey, it's a large employer group plan. It should be primary. Yeah, if you're actively employed. If once you're retired or you're on Cobra, Medicare is going to kick in first for those people over age 65. So in my situation, if Tim stayed the course with me, I would be, as once I'm getting ready to retire, I would be getting them up uploading on Medicare A and B and getting that all set. So when that my status change, he can either stay with me or he can peel off on his own Medicare plan with a Medicare supplement. But even under a 5,000 person group, once you retire non-active employment, Medicare is king for those folks 65 and over. They're going to be first up on the group plan versus group plan. So a couple things, and we're doing pretty good on time. So I want to run through a few caveats here. And this is from Medicare.gov, like when the heck should I apply for Medicare A and B? So what they're saying, if your employer is 20 or more employees, or again, part of a multi-employer group, Medicare.gov says, on Part A, if you don't have an HSA, that's a high deductible plan with a health savings account that I contribute, or as the business contributes to, they're like, if you're not in anything with HSAs, take the A. It's not going to hurt you. But they're saying, again, for larger groups king here, don't take B. Delay it. Why pay for something? If you peel off when you're ready to, and it triggers that special enrollment period. Remember, you have 8 months. I always recommend be early, but you got 8 months to pick up Part A and B, no penalty, or B especially, no penalty. And you also can jump on a Medicare supplement, what they call Medigap plan. It's the same thing. Or you can peel over to Medicare Advantage world. You can do any of this once you've postponed, and then it's triggered that special enrollment period. So you're all good. So they said, yeah, A, if you want to, if it's free, it doesn't hurt you, probably will never come into play, but it's out there. B, you want to delay it. That's a recommendation. If you do have an HSA, this gets a little tricky, because if you do have an HSA and you contribute, IRS doesn't like people that have an HSA and contributing to having Medicare and an HSA. They feel that's double dipping. It's two government programs. You do one or the other. So if you want to still contribute to an HSA, you do not want to take that A. It's tempting because it's like, for most people it's free. Why not take the A? You want nothing to do with Medicare or your spouse on Medicare if it's due to your coverage. You don't want, if you want to be contributing to an HSA. Now, what they do, again, you can still contribute if you delay A and B, but if your spouse wants to, well, I want to start collecting Social Security, you need to be in at least A to get Social Security. So if you've got a situation like that, you're just going to want to stop contributing for that spouse. So if I had Tim on my plan with our HSA, we have a high deductible plan. If Tim wanted to stay the course with me, but he wanted to start taking his Social Security at age 66 while he's still on my plan, I need to stop contributing as a family because it's just him and me. I need to switch it over to single and be sure my employer does too. And the same thing, that last thing to complicate it a little bit more, is what's weird is if you've got that free premium free Part A, when you're ready to elect your special enrollment period, the sort of nice thing is, if it's free, they backdate your A 6 months. But you see where this is going with the HSA contributions. You need to stop contributing to that HSA 6 months prior, or you can correct it up through until you file your taxes on April 15th. The IRS will let you back that out and repay that, or take that out of your HSA, but you want to just be cognizant of that. The fact, if I'm planning long term, I'm like, boy, next July I'm gonna retire. I want to start being mindful. January, I need to cut off my HSA contributions or clean it up. So if you have an accountant, they'll help you with that, but it's easier to just try to catch it up front. So that's the scoop. Again, It's not do or die, but if you got an HSA and you contribute to it for you or your spouse, you just want to be mindful that they will backdate the A. They don't backdate the B, but they backdate that A 6 months, and that's automatic. If you're on a smaller employer plan, you need to sign up A and B. Medicare is going to be first up, like we talked about it. Or if you're in the marketplace, most people definitely want to get out of the marketplace. If you receive most people don't that we talk to, a lot of people don't get subsidies, but you just remember it's like one government kind of program or another. People who are getting subsidies can't stay on and still get subsidies once they're eligible for Medicare. They really want them in. They want them in Medicare, and typically Medicare is quite a bit lower than the marketplace. So there's resources for you. Medicare and You handbook. When you get closer to Medicare, you're going to get one automatically. There's Medicare.gov or 1-800-Medicare. There's also the website for Medicare, Medicare.gov, and also that Cruising into Medicare brochure, little flyer I gave you, gives you some information on who to contact for what. But you've got great folks at Professional Insurance Programs. Wendy and Christine are awesome. And there they are, Wendy and Christine. That is a nut in a nutshell, and it was a quick 55 minutes, Marilyn, of going through what you need to know basically. But the couple things, never feel pressured to make a decision. Now, if you're like behind getting onto Medicare, yes, Wendy and Christine are going to pressure you to sign up for Medicare. That's good, but never feel pressured. People calling you or neighbors like, why didn't you sign up for Medicare? And you're like, well, I don't think I have to. It's amazing how people can be very persuasive and insistent that you need to do something if you feel pressured by anyone, because when you turn 65, like I mentioned with Tim, my husband, he's going to start getting a ton of different reach outs from all different entities. Go to your trusted source, your people that you've been working with. I love working with agents because they've got different options for you. You work directly with one company, directly to the company. They're one trick pony. They're not going to tell you about all the different other options that are out there. So that's why I love working with agents. They'll figure out what's best for you and help you determine the best course of action. Whew. So on that note, any questions? Did we get any in the chat, Marilyn?
As of right now, we don't have any. If anybody has any questions, feel free to put them in the box and I will ask Alisa them for you. But thank you so much for all the information. I mean, Medicare is not easy, especially, to run through.
No,
So,
it's not. Well, I do this a lot, but the really cool thing is, like, especially when I work with, we've worked for years with our friends at PIP, and sorry, I keep calling you PIP, but it's easier to say, and it's Friday. So
no
our
worries.
friends over there, and they do a nice job, and they've got your back. A good agent's going to have your back, and they're going to know, they're going to help you figure out what's best for you. If somebody's trying to sell you something, that's not a good thing. You really need to, probably do a little bit of being a little interactive, figuring out, hey, if I like to travel a lot, I want to call my shots, where I'm going to go. I don't want somebody, having to ask for referrals, things like that. Supplements and original Medicare are great, especially if you're going to be moving around, traveling. It's nice to be able to just go wherever you want to go. Sometimes Medicare Advantage might be a good option too, but it just depends on what's best for each individual.
Okay, well, thanks. It doesn't look like we had any questions come in. Just a reminder that if you are on this, you will get a recording of the presentation that we did today. Make sure you look at the handouts that were on this attachment of the webinar. And if you have any questions, feel free, reach out to Wendy or Christine. They're more than happy to answer your questions, walk you through the Medicare process. So thanks again, Alisa, and to everyone who attended here. Have a great rest of the day and enjoy your weekend. Thank you.
Thank you.
Thank you.